Olivia, thank you for joining me on GB Talks.
Thanks, Harley.
How are you feeling?
Very nervous.
That's okay. You just said I look like your brother.
You do.
Is that a compliment or?
I suppose I can't really say my brother's attractive, can you?
Yeah, I guess that would
Yeah.
be a bad way to start.
Yeah.
What have you been up to this morning?
So wrangled my kids for a few hours, did some housework, did some bookwork, and then I went to Bowen therapy actually. So I go to Bowen therapy every few months.
What's Bowen therapy?
So I go to Lisa. She's at Inner Harmony Bowen therapy. I'm so nervous. I feel like I can't even talk properly. So I go to her. I'm like a really like a busy mind. So I feel like I went to her initially for my son.
Yeah.
He had really bad colic, and I just Jess had said go take him there, and she might be able to help. And then it was like night and day. He just started sleeping. So I was like, you can't placebo a baby. So I was like, I wonder what she can do for me. Like, I wonder if she can just make me more like calm and like my head not as like scattered. And it's been amazing. Like, it's just changed my life. Like, it's amazing.
Wow.
Yeah.
Do you think that your busy mind is a blessing though?
I think it can be a blessing. Like, I'm very driven, and I'm quite like, can be very productive. But then there's like not so good sides of having a busy mind because you can't switch off. Like, I'll be lying awake at 11 o'clock thinking of everything I need to do.
Yeah.
Like, it just doesn't stop.
What do you do when you're lying there at 11 trying to stop your mind? Did she give you any tools or?
I suppose it's just about being like present.
Yeah.
I feel like we've gotten deep really quickly, like in like 90 seconds.
Yeah, good.
Yeah, okay. Yeah, it's just about, I suppose, being present when you have a busy mind. It's very hard to just be in the now. So kids are good for that. Like, you have to be present with kids. But yeah, so there's good and bad parts of having a busy brain. I feel like you've got a busy brain.
Yeah, for me, it's video games.
Okay.
So because you got to constantly react, I imagine it's like having kids.
Yeah.
Like, because there's something always going on
Yeah.
out of your control. You don't really know what's going on, but you have to constantly react. So you can't be too caught up in your own head.
Yeah.
When you're playing video
Yeah.
games, you're always reacting to what's going on
Yeah.
the screen.
Yeah.
So that's what I use to calm myself. It's almost like meditation.
Yeah.
But I have an addictive personality as well.
Yeah, I'm the same.
So I have to be very careful with that.
Yeah.
Before we get too deep into it, do you want to let the Shepparton people know who they're listening to?
So I'm Olivia. I've lived in Shep my whole life, and so have my family. I married my high school sweetheart. I've been with Chris since I was 13, so I'm very much a small town girl. I've got 2 little kids, a 3-year-old girl and a 1-year-old boy. And I'm a registered nurse, so I did my Bachelor of Nursing in Shep. And then I went to our private hospital here, worked for the last 7-8 years, predominantly in theatre, in anaesthetics and recovery. And the last year I've dived into the world of cosmetic nursing, and I'm opening my own business. So, yeah, and my husband actually opened his own business, well, our business, a couple months ago. So we've opened 2 businesses within a month.
Yeah, did you just talk about that? Like, both jumping into the deep end at the same time?
We did. Initially, we were planning on him opening up earlier, but then the pandemic hit and we were like, oh, let's just stay calm. But then, I don't know, we just both, like, I'm much more of a risk taker than him, which is good. We level each other. But I was like, come on, you can do it. Like, he's so smart. He'd set himself up. Like, he's a switched on bloke. I was like, you can do it. And so he did it. And then, so he resigned, and then within 3 weeks of him resigning, I had an epiphany. My little girl broke her arm, which sounds ridiculous. And I was sitting at the hospital and I was thinking, I've got to go to work tomorrow. And I was like, I can't, this is just too hard. Like, trying to juggle all these balls. I was like, I need to make my life work for me. And I'd already, cosmetic nursing was already going to happen. That was already in the pipe work. But I was like, stuff this. I'm going to quit my job. And I did. The next day I went and quit my job. So within 3 weeks, we both quit our jobs. I'm still casual. It's not like I've completely resigned. But yeah, so, and people were like, what are you doing? Like, it's pandemic, we're locked down, you've both just quit your stable jobs. But I think like I believed in my husband, and like I believe in my own vision, so I'm like, we can do it.
You've always spoke so highly and lovingly about Chris. Do you think that you two have done a good job of growing together?
Absolutely.
Like, at the same rate?
No, we didn't grow at the same rate. Yeah, I think like I've been with him since I was 13, so 15 years. So we've changed a lot in those years. We've gone from kids to teenagers to early adults, and now we're adults.
Yeah.
So, like, there was hard times, don't get me wrong, but to think where we are now, I don't think we would be who we are and the couple that we are if we weren't faced with that. I think it's pretty amazing that we can stay together for that length of time. But yeah, I do think so highly of him. He's just a really good bloke, and I don't think there's like many people out there like him. So I'm very lucky.
Yeah, awesome. Do you want to explain how you got into nursing?
I actually always wanted to be a lawyer, which if my family listens to this, they'll laugh, because I remember when I was like, I think I was like 10 or 11, I was like, I want to be a corporate lawyer. I had no idea what that meant. It just sounded good. And then I suppose nursing was always kind of in my world. Like, my mum's a nurse, so I was like, oh. And I applied for nursing and I got in, and I probably was never going to be a lawyer. I probably never would have got the enter to be a lawyer, to be honest. So yeah, I got into nursing and I loved it. I worked in a nursing home for 2 or 3 years while I was studying, and I loved that. That's been the most rewarding job I've ever had.
Yeah, my grandmother worked in a nursing home, and some nights, I can't remember why, but some nights I had to go stay there with her. Like, my father must have been out and I must have just had to go and stay there with her.
Really?
And I've got a few vivid memories from staying in the nursing home those couple of nights, and all the crazy things that I've seen. Like, people,
That's mental.
people as they get older obviously start to lose their sense for like what's correct and what isn't.
Yeah.
And they would always go to the toilet in the pot plants.
How old are you?
Well, I can't recall,
Yeah.
but I just remember that memory, and I was always like, "What is going on
That's
here?"
so funny.
What did you take away from working in a nursing home?
I started when I was 18, and I think being around the older generation, you learn so much. And being faced with life and death, at such a young age,
Yeah.
it just puts things into perspective, I think. And it was just really set me up for nursing in a hospital, because there's so many people that want to get into nursing and they just want the fast pace, like ED and like theatre and ICU and things like that. But you need to know your basics. Like, you need to be able to care for people and like help them shower, and it's like just the most basic stuff, but that's what makes you a good nurse, and that's what makes you empathetic. Like, you need to have those core values. So many people get into it just for the glory, I think, to be honest.
Yeah. It's not like the TV shows, or it is.
No.
Yeah.
No one really yells at each other.
Okay, good.
Yeah.
So let's say you're in your first couple of years in nursing. What are you spending the majority of your time doing?
You're just learning like really rapidly.
Yeah.
Yeah. So.
But in terms of like practical things, like, is a lot of it like getting people out of bed, giving them medication, like.
Not necessarily.
A lot.
Yeah. So I think. Well, that is like I was a ward nurse for the first year, and that's initially what you do, and also like medications and things like that. And then I kind of went into theatre for a rotation, and I loved it there. So like there's so many different avenues of nursing, like ward nursing compared to theatre nursing compared to ED. Like, it's just worlds apart. So I think that's a good thing to note too if someone wants to get into nursing. Like, you're not stuck. You can change. Like, now I'm opening my own shop. I never ever would have thought that when I was at uni that I'd be opening my own shop. Like, that's mental as a nurse.
Yeah.
So yeah, there's so many different avenues to get into.
So fill in the blanks from finishing your degree.
Yeah.
To perhaps making it to the ward. What were you doing most recently again? Sorry.
So theatre nursing.
Theatre nursing.
Yeah.
So what did you do between finishing your degree in theatre nursing?
So I did a grad year on the ward.
Yeah.
Which is kind of what if you do your nursing, you should really do a grad year, where you're supported and you get a rotation through different wards. I got a rotation through theatre, and then once I got into theatre, I just was kind of like, well, that's where I want to stay. So, and then I was there for 7 years in theatre.
Yeah. Okay.
Yeah.
So you didn't try anywhere else? Or you just stayed in theatre?
No, I probably was a bit of like, I wish I had tried other places, to be honest. It's not that I didn't love doing what I was doing in theatre. It's just, I wish I had tried other places, but I don't know. I think if you think like should have, could have, would have, like I wouldn't be where I am right now. If I had have done anything differently, I probably would be in a completely different spot. So
there's always a sense like, what have I missed out on?
Yeah.
No matter what.
That's in
option you
everything in
take.
life, isn't it?
Yeah.
Yeah.
What would you tell somebody who's interested in getting into nursing?
You've got to be doing it for the right reasons. I think, look, it's a really good job. It's a really good, stable job. But it's hard. It's not an easy job to get into. not just what you're dealing with your patients, like that's heavy some days, like people die on you, like that's a lot. But you're dealing with family members, you're dealing with other health professionals, like, yeah, you need to be in it for the right reasons, and you need to really want to be a nurse. Like, don't go into nursing if it's something you've just thought, oh, I'll just go into that. I think, yeah, people won't last. And I think you should do the hard yards in a nursing home, because that's where you get your core nursing from. Like, you need to be able to wipe a bum. Like, it's not the nice part of nursing, but like, you kind of, people, I think so many people in our generation just want to go to the top straight away. You need to work your way up, I think.
Yeah. So with those tough lessons, like, did you have anyone mentor you through those? Like, can you recall, like, the first time somebody passed away on you?
It was my very first day as a student. I had a man hold my hand and die.
Yeah.
Like, literally, like, it was just, that was a lot. I was very emotional. Yeah. In theatre, you don't want people to die.
Yeah.
Like, obviously, that's not, when you work on the ward, that's part and parcel of it. But yeah, so once I got into theatre, you kind of step away from that part of it. But yeah, nursing homes, lots of people died. Lots of people that you thought very highly of died.
Yeah, I remember my nan coming home a handful of times. Like, and obviously she had people pass on her regularly.
Yeah.
But there were some that were obviously more special.
Yeah.
She had a strong connection with, or they were there longer. And she just felt those emotions.
Yeah.
She never let it stop her from going to work the next day, though.
I think it's a real privilege to be around someone when they die. It's like, I don't know, I actually thought about, once I finished my degree, I thought I wanted to get into hospice. But obviously I didn't end up doing that. But it's a real privilege to be around someone when they die. It's just like, it's a turning of life, I suppose. And yeah, I think to be with someone that might have lived 90 years and then you're there when they go and they pass on to the other life. Like, there's something that happens in the room, and I'm not saying that, like, I'm not an overly religious person. I do believe in a higher being, but there's something that happens. And when you're around that, it's pretty amazing, really. And it's a privilege. It's not something, it's like when a baby's born. I think it's the same thing.
Yeah. What is, like, is there a difference between, like, getting into a private hospital compared to, like, the public hospital?
It's the same application process.
Is one more desirable than the other? Like, would people who are doing nursing be aiming for private, or doesn't really
Probably
matter?
more public, to be honest. I think the exposure would be more in a public setting. Private is often nicer clientele, to be honest. I've got some friends that have worked in ED, and that can be a bit challenging at times. You don't really have to deal with that over there. I think there's pros and cons to both. Yeah. I think, like, in the private hospital, I've got to work with some really amazing surgeons and anaesthetists. Like the top of the game in SHEP, where you still would work with them at the base, but probably not as closely, I don't think. But I've never worked at the base, so I can't really compare.
After you finish your grad year, is there more ongoing learning?
Yeah, I think with nursing, you're always learning.
Yeah.
Yeah.
Like on the job, or?
Yeah, on the job.
Yeah.
Yeah.
Okay.
So you can do postgraduates, things like that. I haven't done a postgrad. I didn't feel like... I didn't feel like it was right for me to do that. Doesn't mean I won't do more study in the future. Like, I've had to do a lot of study for what I'm doing now. But yeah, there's so many avenues in nursing. It's mental. It's probably the most broad range that you could have in a profession you could ever get into. So
that's exciting, because I feel like a lot of people burn out in jobs because the progression isn't there. Yeah. Like, especially if there's only one role above you, and that person only leaves the job every 30 years. But if you've got so many paths in nursing, that'd be unreal.
It's good, but it's still, like, once you kind of, like, get into an area, you do get a bit stuck too. Like, you kind of get it into I felt like I was in a bit of a comfort zone. And then, I just pushed myself out of it this year, I suppose.
How awesome.
Yeah.
What is the average, nurse last in the job? How long do they usually last?
I've worked with nurses in their 70s that trained when they were teenagers.
Yeah.
Yeah, I think it's a long... I think in healthcare, like ambulance workers, from what I've heard, people don't stay in that job for long. Obviously, there's people that would stay, but compared to nursing, people stay. And I think that's because there's so many different avenues to go into. Yeah. Like, you can do admin as a nurse. Like, you can do case management. You can do psychiatric. Like, there's so many areas you can go into.
Yeah. Do you want to tell us a little bit about your new business?
Yes. So I am Aesthetic Nurse Olivia. That's my business name. You can find me on Instagram. So I launched, the start of the year, I jumped into the world of cosmetic nursing, and I've studied my ass off. I've been up till all hours of the morning, up super early. Been studying. It's been a really difficult industry to get into, like extremely difficult. I've had lots of people contact me on social media asking, like, how did you do it? And I'm more than happy to help, because someone needed to help me to start with, but it's hard. Like, people don't want to help you. And I've had some amazing mentors the past year, and I've had to make those connections myself. So I've had to have so many people on the phone want nothing to do with me. And you have to have that resilience that when you hang up that phone, you call someone else.
Yeah.
Which is, so it's not so much the clinical side of things I don't find super challenging. Like, there's some areas that I'm like, oh, that's like takes a bit of practice. It's the business side of things, and like, you would know, being on your own, you have to back yourself. Like, no one else is going to back you. Like, my husband backs me.
Yeah.
But like, picking up the phone and calling these complete strangers and being like, will you help me? Like, will you invest in me? And most people say no.
What areas did you need help in specifically?
Training.
Yeah.
So I needed that hands-on training. And so I've had some amazing people that have taken me under their wing and trained me. That was the main thing, really, because there's no clear path for cosmetic nursing. I think that's going to change in the next few years, but there's no like postgraduate you can do or anything like that. So it's a bit of a rogue industry at the moment. And it's a bit of in the blurred lines, like, it's beauty. And I find that difficult too, because it's beauty, but then I'm like a health practitioner. So like, I find that transition a little bit difficult.
What would you consider it? Beauty?
No, I think the knowledge that you need to have to do it, you're a health practitioner.
Yeah.
So like, when I refer to people that come to me, I refer to them as patients, not clients, because I'm doing a full medical background on them. I'm scripting with a doctor. Like, there's going to be people that have to turn away for medical reasons, or body dysmorphia. That's massive.
Yeah.
So I think it's kind of in between, but I see it more as it's a medical procedure.
Yeah. I was speaking to my business partner, and I mentioned you were coming on.
Yeah.
And I know you semi well.
Yeah. And
he was like, I would be blasting this girl and asking her, like, why would she just go and inject people with this and that and this and that? And I said to him, I think it's pretty like substantial amount of information gets given to the client, and
absolutely.
They get a consult. It's not like you're just going to go in and do whatever to make some coin. Like, you genuinely want to make the people look better and know what they're getting in for.
Yeah, absolutely. Like, I think my interest in cosmetic nursing came from working with plastic surgeons, and it was a side of nursing I hadn't really ever seen, was like, people feel better about themselves. And I'm not saying that it's going to make them happy. Like, getting anti-wrinkle treatment is not going to make you happy, but it makes you feel better about yourself. It's like why someone goes and gets their hair dyed, or gets their eyebrows microbladed, or puts eyelashes on. Like, we all want to look good.
Yeah.
So I make people feel good. Like, it's a good thing. I think it has a bad rap from probably Hollywood, and I think probably the middle, like my parents' generation, are a bit against it.
Yeah.
That's okay. I think our generation's super open to it. So it's changing. But I think people have this idea that they're going to come out looking like they've had all this work done, and that's not the case at all. Like, most people that look like that have had plastic surgery. They've got actual implants in their face, or they've been botched. But getting anti-wrinkle treatment or getting fillers is not going to make you look botched unless your practitioner goes overboard, which they shouldn't.
Yeah, I know people who get treatments done, like the ones you mentioned, and it's subtle. Like, I wouldn't even be able to pick why they look better. Yeah. But I can tell that they do.
Look different, yeah. They look more awake and youthful. And I think it's a bit of a taboo industry still. Like, there's so many people that get it. Like, I'm booked out nearly for the whole of December.
Yeah.
There's so many people that get it, but how many people talk about it, I'm not sure. I think that's changing though.
Yeah. I guess it's one of those things that will, it's kind of starting to get pushed to be more accepted.
Yeah.
Like, I don't think there's anything wrong with wanting to look good. It's the same thing that I do.
Yeah, of course.
Like, I try and help people get fitter so they feel more confident in themselves, and it relates into every aspect of their life.
Yeah.
They perform better at work. They have better relationships with their partners.
Yeah.
Do you know what I mean? It's
like, I don't know why people have this stigma around people wanting to look good. Like, unless you're holding someone down and injecting someone. Like, everyone's doing it willingly on their own. Like, we're all adults. Everyone can make their own decision. Do you know what I mean? I don't know why people have to have such an opinion on what other people are doing.
Yes, that's a very good point.
Yeah.
What procedures do you think you'll be doing most commonly?
Anti-wrinkle. The reason why I say anti-wrinkle is because I'm not allowed to say the trade name. Legally, I'm not allowed to say it. That's why I don't say the other word. I've got a lot of lip fillers booked in, cheeks. I'm going to be offering more services as the time goes on. I'm just wanting to keep it small to start with. But there are medical reasons why some as well. Oh, there we go. I just said the word anti-wrinkle. You might have to blurt that out.
That's right, I can do that.
So people that have jaw clenching, teeth grinding, headaches, we can treat their masseters, and that can help relax that muscle, and often that resolves that issue for them. Or if someone that has chronic sweating, we can treat that. Like, there's so many things that you can do. There's bladder dysfunction, which obviously I'm not going to do, but that surgeons use with anti-wrinkle treatment. So yeah, it's quite an amazing drug, really.
So how does the drug work?
So it relaxes the muscle. So it works on the nerve that makes the muscles contract, and so it stops that. It stops that from happening, essentially. But it comes back. It's not like you have the treatment and then you don't have any movement ever again. Like, within 4 months, you're going to need more.
Yes.
So, yeah.
What questions are most commonly asked by potential clients? Like,
the most common concern people have is, I don't want to look fake, which I did a post on that the other day because I was like, that is never my intention. Like, I don't want you to look fake either. If you walk out and someone's like, well, she's had too much work done, like, I failed.
Yeah.
Like, I haven't done my job right. Dosages people ask about a lot. Not too much. People are really excited. Like, it's a really cool industry to be getting into. Like, people are excited to be feeling more youthful and, yeah, feeling good about themselves.
So I send you an Instagram message and say, hey, Olivia, I'm interested in coming in, but I'm worried I'll look fake. How do you respond to that?
I would say that I treat conservatively, which I do. I'm not going to go with the biggest dose that I can. Mm-hmm. There's therapeutic doses, and I will treat on the lower end that I think can give you the desired outcome you want. I get the patients back in 2 weeks after, where we can top up if need be, if you're not happy with the result. But we can put more in, we can't take it out.
Yeah.
So that's how I treat. So it's not something I'm worried about doing to someone, and I've already had people that have messaged me and I've already said, no, I won't be treating you. Just from messages, sent me photos of their lips, or said they want this done, and I will say, you don't need that done. Which kind of, that's where my nursing background, like, I'm ethical. Do you know what I mean? I'm not doing something to make a quick buck.
Yeah.
So, like, my appointments for anti-wrinkle are 45 minutes. Some people you can go to and in and out in 10 minutes, but I've allowed that time. So the patient's educated, they're informed. They can change their mind in there if they want to. They're not coming into me and they have to have it done. So, yeah.
I've travelled past places in Melbourne, and it looks like you can just walk in and get it done straight away. Is that right, or am I mistaken what those stores actually are?
It's right. That's what I said about the industry. It's quite rogue. Like, there's some really unethical people. They're all health practitioners. You have to be.
Yeah.
But there's people that are in it just for money, like any industry. Just make as much money as they can. Get you in 10 minutes, get you out.
Do you need to be a nurse?
Yeah. You have to be a nurse. A nurse, a dentist, or a doctor.
Yeah.
In the UK, I mean, some cosmetic groups, they can be beauty therapists, but they have a lot of complications over there.
Yeah.
So that's probably why.
So with something like a lip filler, or just like a basic anti-wrinkle treatment, what are we looking at price-wise?
Anti-wrinkle is really hard to give a price because it depends on how many units you need. Like, what a female needs compared to a male is very different. Some people might just want their forehead treated or their frown, or like, it's a really hard. It's $15 a unit. That's what I charge, but that doesn't mean much to people because they don't know how many units they need. So that's why I like people to come in for a consultation, or when they come into me, I won't ask them their budget. I don't want to know your budget to start with, because I want to tell you what I can do for you in my price range, and then if it can work, it can work. There's no point just doing a few units here and there. It's not going to work. Yeah. So I need to treat you properly, or you wait and come back when you can afford to have the treatment done properly. Fillers range as well. That's why consults are really important. That I don't charge for my 15-minute consults. I've got a lot booked in. And so Yeah, there's no you're not going to have treatment and then all of a sudden be done with a massive bill. Like, I'm going to tell you before you have treatment, this is how much it's going to cost, and then you can decide where you go from there.
Yeah, great. What are the long-term effects of some of these procedures? Because in some people's minds, maybe in my mind, it's kind of like it lasts short term and then it kind of looks a bit weird.
So all that will happen is, so after 3 to 4 months, the anti-wrinkle treatment will wear off, and you will just look like you did before. That's it.
Yeah. So it's like something you've got to kind of commit to for...
People get hooked. So that's the thing. Like, if you come in, like, if anyone comes in, you're not going to stop getting it done.
Yeah.
You might, but it's very unlikely.
Yeah, okay.
For fillers, there is one risk, and it's called a vascular occlusion, where a blood vessel blocks off, and that can cause necrosis, which is death of tissue. Or if it's done in certain areas, such as your tear trough or your nose, it can cause blindness. So you have to be trained.
Yeah.
Which I am, and you need to be able to pick it up quickly and treat it. So it's a risk, absolutely. Like, whenever someone comes in for fillers, I'll say, this is the risk. I do know how to treat it. You need to know what to look for as well, but it is treatable. And that's a problem in UK, I think they're having, is that people aren't trained. So they're having these occlusions and people's faces are falling off.
Wow.
Yeah. But that's not something to be scared of. You just need to make sure you go to someone that's informed. That's all. Which everyone in Australia should be, because they have to be health practitioners.
Is there other people in Shepparton offering these services?
Yep, there is. I think there's some people that visit, and there's maybe 2 or 3 other places that are here all the time in Shep.
Yeah, I think it says something that you're working towards a storefront. Yeah. Like, whereabouts are you working?
In Friar Street.
Yeah.
Yeah. Out of Chowbella.
Yeah.
Yeah.
So I like that you're not travelling. So if anyone has any questions or anything like that, they can come straight to you. And
there's nothing wrong with the travelling injectors. Like, some of them are brilliant that come to Shep, but they might come once a month. Yeah. So if you have a problem, you either have to go to Melbourne or wherever they're from, or you have to wait until they come back. So I like the fact that if I have a patient that calls me in the middle of the night and is concerned, they can come in the next morning and see me.
Yeah, that's great.
Yeah.
And I also love the fact that you're a local.
Yeah.
And having a crack as well. That's got to say something.
I've been really overwhelmed with the support. It's like, I remember the night before I launched my bookings, I said to Chris, as long as I get 1 patient a week, like, I'll be happy. Like, I've done well. And then within 48 hours, my whole first week was booked out. And yeah, just the support from locals, the support from my friends, like, it's like takes me back, to be honest. Even with my husband, with his business, like, he's Shepparton Engineering, we own that business, and he's a welder, and he's flat out, and he's just opened, and it's just people supporting him. We haven't really advertised for him, even just word of mouth, and I think people really get around locals. I think people like to see locals do well. I know I do. Yeah. So.
Yeah, great. Was there any thought process to the name, or? There
was.
Yeah.
Chris initially wanted me to go with, like, a name, like
a business name,
like Origin Athletics or something. But I was like, no, I want to brand myself, because I know for me, if I go to an injector, I'm going to that person.
Yes.
I'm not going to the store. So I want people to feel like they know me, they know who I'm about, what I'm about. This is why this is probably really cool, because, and it's really important to me is people DM me and I reply, and I take my time and reply, and they say, oh, thank you so much for getting back to me and taking the time. And I'm thinking, do people not take the time for their clients?
Yeah.
They probably don't. But for me, that's really important. I want people to feel like I care, because I genuinely do.
Yeah. So that's why you put your name on it.
That's why I put my name on it. I thought I'll brand myself, and I think it's worked pretty well, to be honest. What did you think of me using my name?
It was awesome.
Oh, you liked it.
Like, I think the way that you've presented the whole thing makes it very credible. Yeah. And, like, just who you are as a person. Like, I know that you're serious, you're passionate.
Yeah.
You have all those pillars that make somebody great at what they do.
Yeah.
Do you know what I mean?
Thank
like,
you.
I wouldn't expect you, like, the way you've answered these questions today, I wouldn't expect anything less than what you've exactly described.
Yeah.
Like, if I was interested in a procedure like this, they're the things that I would like to hear. Like, I'm going to use a conservative dose.
Yeah.
I'm going to let you know how much it is. I'm going to let you know that you can message me anytime, and I'm going to put your mind at ease.
Yeah.
Like, those things are your character, and they're the things that I would want to see in somebody who is offering a service like the one you're offering.
Yeah.
What problems did you have setting up the business? Or maybe not problems, but what were the challenging parts about that? You set up the ABN, were you sitting in the lounge room with Chris some nights just antsy as what are we going to do to get people through the door, and when are we going to set up the Instagram? That's the best bit of it all.
Yeah, Instagram was fun. When I launched, I was like, this is so cool. I don't know. I'm a very for me to come here and be really nervous is strange, because I'm very I know what I have to do when I do it.
Yeah.
So I kind of didn't really feel that way. The only hurdles I faced was getting into the industry, finding people that were willing to give me a shot, things like that. But I don't know, my parents run a business, and so they've run a business my whole life. I think when you grow up around that, all that terminology kind of just comes naturally. We've got a really good accountant that helps, I think. I'm not saying I haven't found it hard, because there's been points I've been really stressed, and some people say how do you do it with your kids and everything, but if you really want to do something, you'll make it work. And I think that's why it has done so well, and that's why Chris has done so well, is we're really passionate about what we want to do. I'm very much someone that has visions. I have visions of how I want something to go, and so I go into it, and it's I didn't actually expect it to work as well, to be honest. I didn't think I would do this well so far. But yeah, it's I said to Chris the other day, my vision worked. It worked. So
yeah,
you just got to back yourself. You have to back yourself, because there's people that don't want you to do well either. Do you know what I mean? It's everyone wants you to do well until you do better than them. So you just have to back yourself, and yeah.
I remember when I was starting in the fitness industry, my very first PT, I was sitting on a machine in Snap Fitness, and another personal trainer who didn't work at my gym but worked out of the gym I was at, he came up to me and he said, "Why are you looking so nervous?" And I was like, "I'm about to have my first PT." And he said, "Oh, you've done the study, you look great, you're in great shape yourself, you have nothing to be worried about." And that put my mind at ease so much.
Yeah.
But then the terrible thing about that story was a few years later, when I sat down with him and I said, "I'm going to open up my own gym."
Yeah.
And he said, "No way, you won't make it."
Wow.
Because it was exactly what you just described. He wanted me to do well.
Yeah.
But he didn't want me to do better than him.
Yeah.
And I as soon as he said that to me, I threw him out.
Yeah.
I had no time left for him.
Yeah.
I understood his concern, but he didn't deliver it in a way that was I'm
wasn't
looking
genuine.
out for you.
Yeah.
It was just no, not you.
Yeah, don't do that.
Yeah. And I just got rid of him straight away.
Yeah. Yeah.
You wouldn't have had many people think that about you. No way.
I reckon there would be a few people out there that probably have, but I think that's part and parcel of it. You just have to have confidence in yourself, and keep focused. I'm so focused right now.
What's the next step? Procedures haven't started yet?
No, so we take over our clinic on Monday, so we'll set everything up, and then the following week I have patients. Yeah. So that's the next step. And then...
Time off for Christmas?
Yeah, we're taking, I think, 10 days off over Christmas, which will be nice. Because it's really important to me too. It's great to have all this... it's great to be successful, and that's ultimately what I want. I am a career woman, and I want to do well. But if my family's not happy, if my kids suffer, if my marriage suffers, if my unit is sacrificed at any point, Chris says the exact same with his work, it means nothing.
Mm-hmm.
I don't want any of it. So, yeah, I think... that's my core why I'm doing everything, is for my family. I know that's cliche, but it's the truth. To give us financial freedom, and to be able to go to reading with the kids when they go to school, and little things like that when you work in a job and you've got a boss, you can't pick and choose when you want to work. So
yeah. So 2021 looks like more time with the family, and
it's trying to make that balance.
Yeah.
I think that's it's hard. It's really hard as a mum. Hats off to all mums, because that juggle, no matter what you do, if you're a stay-at-home mum, that's bloody hard. I could never be a stay-at-home mum. It's just not for me.
Yeah.
And that's not saying that stay-at-home mums aren't doing anything. They're doing more than anyone.
Mm-hmm.
But yeah, trying to find that balance next year. I really want to be able to the time off I've got with the kids, be really present, and then the time at work, like I want to do well. So the time I'm at work, do well.
Yeah.
Like, but it's getting that balance is not going to be easy though.
Yeah.
You're always going to feel like you suck at something, I feel.
Yeah. Something's got to give, but I think if you're aiming for balance, that's the best thing to aim for, rather than obsession.
Yeah.
Which will crumble everything else around you except for the one thing that you're focused on.
Yeah.
Have you given much thought to the end goal?
I'm not sure of the end goal. I'm open to kind of anything. I think business-wise, I'd like to see myself expand with services I offer. Maybe one day I'll have other people working for me. Not sure. Chris's business, hopefully we can put someone on next year. I'm kind of very open to what's to come for our businesses. For me personally, like it's just like as long as I'm happy, I don't care. Like that's ultimately what I'm always working towards is like, doesn't mean you wake up every day and that you're happy and you're jumping from wall to wall, but like ultimately giving my kids the best life they can have and me, us just being happy. Yeah. And I know that sounds so simple, but really if you focus on anything else, you're missing the whole picture.
Yeah. You've got a lot of responsibility.
Yeah, a huge amount.
The more responsibility you have, the more open you are to not being happy, I find, because you have to worry about other things. Yeah. Like if it was just you by yourself, it's easy to be happy.
Yeah.
But when you've got kids, a husband, a career, don't you feel like instead of happiness, you're giving your life meaning, which leads to like a deeper happiness?
Probably.
That's how I kind of look at my life. Like I stress about the gym, I stress about my clients, I stress about my friends. Yeah. But like I wouldn't change any of that.
Yeah.
Like that is what ultimately gives me the deepest happiness.
Yeah, you're right. I think, it's fulfillment really.
Yeah.
Yeah.
Awesome. Last question. Who locally inspires you? Don't say Jess.
I love Jess. Who inspires me? My parents, definitely. They've been the biggest inspiration for me. So I'm going to plug them as well. Housel's Roof Tiling. So they've done really well in business. My dad really inspires me. He's a very driven man, and I think that's probably where my risk taking has come from. I've got a lot of girlfriends in business, and I don't think until I got into business I didn't realize how hard that was. And so I look at them now, I'm like, wow, like you're killing it, like good work. Yeah. And who else in business? I'd probably say my parents are the most inspiring to me. Yeah.
Are they proud of you?
I think they are, yeah. I hope to make them proud, yeah.
How did they respond when you told them you were going out on your own?
Yeah, they've like they backed all of us kids like 110%. And I think I have been lucky. I do have my parents to fall back on. Like I'm never going to be homeless. I can live with them. So I remember when we were launching our businesses, I said to Chris, like, always think, okay, what's the worst case scenario? And worst case scenario was we go bankrupt and I'm moving with my parents. And
that's not that bad.
It's not that bad. Like if I have to start from scratch again at 28, well, so be it.
You would rise from the ashes like a phoenix.
Do you know what I mean? Like that's not the worst. That's not the worst. If someone could potentially be homeless, maybe that's not a risk you'd want to take.
Yes.
But if the worst thing is you have to move in with your parents or, do you know what I mean, someone, well, so be it. You'll start again. I'll just go get another job.
Yeah. Yeah. I'm on the same
page.
I mean? I'm on the same page. So, like, what would you say to somebody who's sitting on the fence? Last thing, like if you right 3 years ago you could speak to her, what would you say to her? Or you still think you're on the journey?
You still needed
those years, yeah.
Yeah, I think I've still got so much to learn in life. Like I'm only 28. Yeah. Do you know what I mean? But I just love the thought of like anything's possible. Like I'm not someone that does sit on the fence. So if I have an idea, I'm like, yeah, let's do it. Like I'm just all in or nothing.
Yeah.
And I love taking risks. Like I love doing something and thinking, how is this going to work out? Like you could fall flat on your face. That's a good possibility, but you could do really well. That's the alternative. And I think if you're sitting on I don't know. I think it comes down to your personality too, though.
Yeah.
Because if you're a fence sitter, you're a fence sitter. I'm not a fence sitter, so I can't relate.
Yeah.
But if you're a fence sitter, well, I don't know. Get off the fence. Like, do you mean? Take a risk or...
Sorry.
That's okay.
Like, did you see much regret in the nursing home? Like you would have looked after some of those fence sitters.
I don't think I was mature enough to realise.
Okay.
Yeah. I don't think I would have thought that deep, to be honest.
Yeah.
Yeah.
That's fair enough.
Yeah.
Awesome. Thank you for coming.
Thank you, Harley.
You
that
did
wasn't
awesome.
so bad.
Thanks, Olivia.
Thank you.